What is a prostate abscess and how does it develop? Have you ever wondered what a prostate abscess is and how it forms? A prostate abscess is a localized collection of pus within the prostate gland, primarily caused by a bacterial infection. This condition often arises as a complication of acute bacterial prostatitis, where an infection leads to the formation of a pus-filled pocket inside the prostate tissue. The prostate is a small gland located just below the bladder and surrounds the urethra. It plays a crucial role in producing much of the fluid found in semen. When bacteria infect the prostate, inflammation occurs. If this infection worsens or is not treated effectively, pus can accumulate, leading to an abscess. The development of a prostate abscess typically follows a series of steps. First, an initial bacterial infection usually occurs, often caused by common urinary tract bacteria like Escherichia coli. These bacteria can enter the prostate through retrograde flow of infected urine via the prostatic ducts. Next, this infection leads to acute bacterial prostatitis, which causes inflammation and swelling of the prostate gland. If the infection is severe or persistent, localized areas of tissue death and pus collection can develop, resulting in an abscess. Several risk factors can increase the likelihood of developing a prostate abscess. Conditions such as bladder outlet obstruction, a compromised immune response, diabetes, and recent prostate cancer treatments like radiation therapy can all contribute to this risk. Men with recurrent urinary tract infections are also more susceptible. Symptoms of a prostate abscess can be quite uncomfortable and may include frequent urination, painful or difficult urination, and difficulty emptying the bladder. Patients may experience pain in the pelvic area, particularly between the scrotum and anus, fever, and sometimes even blood in the urine or pus discharge from the urethra. A physical examination may reveal an enlarged and tender prostate, and a rectal examination can be painful. Diagnosing a prostate abscess often involves imaging studies such as prostate ultrasound or computed tomography scans to detect the presence of the abscess. Cystoscopy may also be used to aid in diagnosis. This can be challenging, as symptoms often overlap with other prostate conditions like acute prostatitis. Treatment for a prostate abscess typically requires a combination of approaches. Antibiotic therapy is essential, and doctors usually start with empiric antibiotics that penetrate prostate tissue well, such as fluoroquinolones, while waiting for culture results. In many cases, drainage of the abscess is necessary. This can be done through transurethral evacuation or transperineal aspiration to remove the pus and relieving symptoms. It is important to note that men who have undergone prostate cancer treatments, especially radiation therapy, may have an increased risk of developing prostate abscesses due to changes in tissue and immune response. Prompt diagnosis and treatment are crucial to avoid complications like fistula formation, which are abnormal connections to adjacent organs or persistent infections. In summary, a prostate abscess is a serious complication of bacterial infection in the prostate gland, characterized by pus accumulation. It typically develops from untreated or severe bacterial prostatitis, with diagnosis relying on imaging studies and treatment requiring antibiotics and drainage. If you suspect you may have a prostate abscess or are experiencing symptoms, it is essential to consult a healthcare professional for personalized medical advice.